Imagine this. You wake up to a seemingly normal day, but your body is trying to tell you something. There's a silent alarm going off inside you, one that could hold the key to your overall health. What if I told you that the answer lies within your liver? Yes, that's right. Your liver, often overlooked and underestimated, could be sending out warning signals that you might not even realize. In this video, we're delving into the realm of liver health, uncovering 11 critical warning signs that your liver might be on the brink of collapse. From subtle hints like chronic fatigue to unmistakable signals like jaundice, each sign serves as a crucial indicator of your liver's well-being. So, buckle up as we navigate through these red flags, equipping you with the knowledge to recognize them early and take action before it's too late. Because when it comes to your liver, vigilance could mean the difference between life and death. Before we dive in, don't forget to hit the subscribe button and notification bell so you won't miss any of our future videos. Number 11. Yellowing of the skin and eyes. Jaundice. Jaundice, characterized by the yellowing of the skin and eyes, occurs when there's an excess of bilirubin in the bloodstream. Bilirubin is a yellow pigment produced during the breakdown of red blood cells. Normally, the liver processes bilirubin and excretes it through bile. However, when the liver is unable to metabolize it efficiently due to disease or dysfunction, it builds up in the body, resulting in jaundice. Therefore, jaundice serves as a visible indicator of impaired liver function. Jaundice is not merely a cosmetic issue. It's a symptom of underlying liver problems that require urgent medical attention. Ignoring jaundice can lead to serious complications, including liver failure. So if you notice yellowing of your skin or eyes, it's crucial to consult a healthcare professional promptly for a proper diagnosis and treatment. Early intervention can significantly improve the prognosis and prevent further liver damage. Number 10. Abdominal pain and swelling. The liver is located in the upper right quadrant of the abdomen, so when it experiences problems, it often manifests as abdominal pain. Liver-related abdominal pain can stem from various causes, including inflammation, enlargement, or the development of liver diseases, such as hepatitis or cirrhosis. Additionally, conditions like liver abscesses or gallstones can also lead to abdominal discomfort due to their proximity to the liver. Liver-related abdominal pain can present in different forms, ranging from a dull ache to a sharp stabbing sensation. Some individuals may experience a feeling of fullness or pressure in the upper right abdomen, while others may describe it as a throbbing pain that radiates to the back or shoulder blades. It's essential to pay attention to the characteristics of the pain, such as its intensity, duration, and any accompanying symptoms, as these can provide valuable clues about the underlying cause. Abdominal swelling, also known as ascites, is a common complication of advanced liver disease. It occurs when fluid accumulates in the abdominal cavity due to decreased liver function, leading to increased pressure in the blood vessels. This swelling can cause discomfort, difficulty breathing, and a visibly distended abdomen. Moreover, ascites can indicate the presence of significant liver damage and should prompt immediate medical attention. Ignoring abdominal swelling can result in further complications, such as infection or kidney problems, highlighting the critical importance of recognizing it as a warning sign of potential liver issues. Number 9. Dark urine and pale stools. The color of urine and stool can serve as indicators of liver health. Normally, urine is pale yellow to straw-colored, while stools are typically brown due to the presence of bile produced by the liver. However, when liver function is compromised, bilirubin is a pigment responsible for the brown color of bile, may not be adequately processed and excreted. As a result, bilirubin can accumulate in the bloodstream and manifest in urine as a dark amber or brownish color, while stools may appear pale or clay-colored due to reduced bile content. Changes in urine and stool color can provide valuable insights into liver function and overall health. Therefore, it's essential to pay attention to these changes and seek medical advice if abnormalities persist. Dark urine and pale stools could signify underlying liver problems such as hepatitis, cirrhosis, or bile duct obstruction, which require prompt evaluation and treatment. By actively monitoring urine and stool color, individuals can potentially detect liver issues early, facilitating timely intervention and better outcomes. Number 8. Chronic fatigue and weakness. The liver plays a crucial role in energy metabolism as it processes nutrients and removes toxins from the bloodstream. When the liver is compromised, such as in cases of liver disease or inflammation, its ability to perform these functions efficiently diminishes. As a result, the body may experience a buildup of toxins and metabolic byproducts, leading to feelings of fatigue and weakness. Additionally, liver dysfunction can disrupt the production of proteins and hormones necessary for maintaining energy levels, further contributing to fatigue. While occasional tiredness is a common experience and often resolves with rest, chronic fatigue is characterized by persistent feelings of exhaustion that don't improve with rest or sleep. Unlike normal tiredness, which can be alleviated by addressing lifestyle factors like stress or inadequate sleep, chronic fatigue may indicate an underlying health issue such as liver dysfunction. It's essential to distinguish between the two and recognize when fatigue becomes chronic and debilitating. Managing fatigue associated with liver dysfunction involves addressing both the underlying liver condition and lifestyle factors that may exacerbate symptoms. Tips for managing fatigue may include adopting a balanced diet, staying hydrated, getting regular exercise within one's limitations, and practicing stress reduction techniques like mindfulness or relaxation exercises. However, if fatigue persists despite these measures or is accompanied by other concerning symptoms, such as jaundice or abdominal pain, it's crucial to seek medical advice promptly. Persistent fatigue could be a sign of significant liver damage or complications that require medical intervention, so it's essential not to delay seeking professional help. Number 7. Nausea and vomiting. The liver plays a crucial role in the digestion process by producing bile, a substance necessary for breaking down fats and aiding in the absorption of nutrients in the small intestine. When the liver is dysfunctional or diseased, such as in cases of liver inflammation or cirrhosis, its ability to produce and regulate bile may be compromised. This can disrupt the digestive process, leading to symptoms like nausea, vomiting, and indigestion. Additionally, liver dysfunction can result in the accumulation of toxins in the bloodstream, which can further irritate the gastrointestinal tract and contribute to digestive issues. Nausea and vomiting are common symptoms of liver dysfunction and can occur for various reasons. Liver-related nausea may stem from factors such as impaired bile production, gastrointestinal irritation from accumulated toxins, or alterations in hormone levels due to liver disease. Vomiting may occur as a reflexive response to nausea or as a result of gastrointestinal inflammation and dysfunction. Therefore, persistent or recurrent nausea and vomiting should prompt consideration of underlying liver issues and warrant further evaluation by a healthcare professional. Managing nausea associated with liver dysfunction involves addressing both the underlying liver condition and symptom relief. Strategies for alleviating nausea may include dietary modifications, such as eating small, frequent meals and avoiding greasy or spicy foods, staying hydrated, and practicing relaxation techniques. Over-the-counter anti-nausea medications may also provide temporary relief. However, if nausea persists or is accompanied by other concerning symptoms, such as jaundice, abdominal pain, or unexplained weight loss, it's essential to consult a healthcare professional promptly. Persistent nausea and vomiting could indicate significant liver damage or complications that require medical intervention, so it's crucial not to delay seeking professional help. Number 6. Loss of appetite and weight loss. Liver dysfunction can profoundly impact appetite and metabolism through various mechanisms. Firstly, the liver plays a central role in regulating glucose metabolism, storing and releasing glucose as needed to maintain blood sugar levels. When the liver is compromised, such as in cases of liver disease or inflammation, this regulation may be disrupted, leading to fluctuations in blood sugar levels that can affect appetite. Additionally, Liver dysfunction can alter the production of hormones involved in appetite regulation, such as leptin and ghrelin, further influencing appetite and metabolism. Furthermore, the buildup of toxins in the bloodstream due to impaired liver function can contribute to feelings of malaise and decreased appetite. Changes in eating habits, including loss of appetite and unexplained weight loss, can be significant indicators of underlying health issues, including liver dysfunction. Monitoring changes in eating habits allows individuals to recognize potential signs of liver problems early and seek appropriate medical attention. Loss of appetite and weight loss can be early warning signs of liver disease or other serious conditions, so it's essential not to ignore these changes and to discuss them with a healthcare professional promptly. Maintaining a healthy appetite and weight is crucial for overall well-being, particularly in the context of liver health. Strategies for promoting a healthy appetite and weight may include consuming nutrient-dense foods that are easy to digest, such as fruits, vegetables, lean proteins, and whole grains. Additionally, eating small, frequent meals throughout the day can help regulate blood sugar levels and prevent fluctuations in appetite. It's also essential to stay hydrated and engage in regular physical activity to support metabolism and overall health. However, if loss of appetite or weight loss persists despite these measures, it's important to consult a healthcare professional for further evaluation and management. Persistent changes in eating habits could indicate underlying health issues that require medical intervention. Number 5. Swelling in the legs and ankles. Liver problems, such as liver disease or cirrhosis, can disrupt the normal balance of fluids in the body, leading to fluid retention or edema. The liver plays a vital role in regulating blood flow and producing proteins necessary for maintaining fluid balance. When the liver is damaged or dysfunctional, it may fail to produce enough albumin, a protein responsible for keeping fluid within blood vessels. As a result, fluid can leak out of blood vessels and accumulate in surrounding tissues, leading to swelling in areas such as the legs and ankles. While mild swelling in the legs and ankles can occur for various reasons and may resolve on its own, persistent or severe swelling warrants medical attention, especially if it's accompanied by other symptoms such as abdominal pain, jaundice, or changes in urine output. Persistent swelling in the legs and ankles can indicate significant liver damage or complications, such as portal hypertension or fluid buildup in the abdomen, ascites, which require evaluation and management by a healthcare professional. Ignoring persistent swelling can lead to worsening symptoms and potential complications, so it's essential to seek medical advice promptly for proper diagnosis and treatment. Number 4. Itchy skin. Liver issues can contribute to itching of the skin, a condition known as pruritus, through various mechanisms. One primary cause is the buildup of bile salts in the bloodstream due to impaired liver function. Normally, the liver processes bile and excretes it into the digestive system to aid in fat digestion. However, when the liver is compromised, bile salts may accumulate in the bloodstream, leading to their deposition in the skin and subsequent irritation and itching. Additionally, liver dysfunction can result in the accumulation of toxins in the body, which can also contribute to skin itching. The liver plays a crucial role in maintaining overall skin health through its involvement in various metabolic processes and toxin clearance. When the liver is functioning properly, it helps regulate blood flow, hormone levels, and nutrient absorption, all of which contribute to healthy skin. However, when liver function is compromised, as in cases of liver disease or dysfunction, these processes may be disrupted, leading to skin issues such as itching, jaundice, or changes in skin color and texture. Therefore, maintaining optimal liver health is essential for preserving skin health and preventing skin-related complications. Managing itchy skin associated with liver dysfunction involves addressing both the underlying liver condition and symptom relief. Tips for managing itchy skin may include avoiding hot showers or baths, using mild, fragrance-free skincare products, applying moisturizers to keep the skin hydrated, and wearing loose-fitting clothing made from natural fibers. Additionally, over-the-counter antihistamines or topical anti-itch creams may provide temporary relief. However, if itching persists or is accompanied by other concerning symptoms, such as jaundice, abdominal pain, or fatigue, it's essential to consult a healthcare professional promptly. Persistent itching could indicate significant liver damage or complications that require medical intervention, so it's crucial not to delay seeking professional help. Number 3. Mental confusion and difficulty concentrating. Liver dysfunction can have profound effects on brain function due to the liver's role in metabolizing toxins and regulating blood flow. When the liver is compromised, toxins that would normally be filtered out of the bloodstream can accumulate, leading to a condition known as hepatic encephalopathy. This condition can result in cognitive impairments such as confusion, difficulty concentrating, and changes in behavior. Additionally, liver dysfunction can impair the production of essential proteins and hormones that support brain health, further exacerbating cognitive symptoms. Cognitive symptoms associated with liver dysfunction can vary in severity and presentation, but often include confusion, forgetfulness, difficulty concentrating, and impaired judgment. Individuals may experience mental fogginess, disorientation, or lapses in memory. These symptoms can significantly impact daily functioning and quality of life, making it challenging to perform tasks that require focus and attention. Additionally, cognitive symptoms may fluctuate in intensity, worsening during periods of liver decompensation or acute illness. Cognitive symptoms associated with liver dysfunction should not be overlooked, as they can indicate significant liver damage or complications that require medical intervention. Hepatic encephalopathy, in particular, can progress rapidly if left untreated, leading to serious neurological complications and even coma. Therefore, if you or a loved one experience confusion, difficulty concentrating, or other cognitive symptoms, it's crucial to seek medical help promptly. A healthcare professional can perform diagnostic tests to assess liver function and determine the underlying cause of cognitive impairment, allowing for timely treatment and management. Early intervention can help prevent further deterioration and improve overall prognosis. Number 2. Persistent abdominal swelling and pain. Liver dysfunction, such as cirrhosis or liver inflammation, can result in the accumulation of fluid in the abdomen, a condition known as ascites. Ascites occurs when the liver is unable to produce enough albumin, a protein that helps regulate fluid balance in the body. As fluid builds up in the abdominal cavity, it can cause swelling, discomfort, and a feeling of fullness. Additionally, liver-related abdominal pain may result from inflammation or enlargement of the liver, stretching the surrounding capsule and causing discomfort. Individuals with liver-related abdominal swelling may notice a gradual increase in abdominal girth and feel bloated or heavy. The swelling may be accompanied by abdominal pain or tenderness, which can range from dull aches to sharp stabbing sensations. The pain may worsen with movement or pressure on the abdomen and may be accompanied by other symptoms such as nausea, vomiting, or difficulty breathing. Persistent abdominal swelling and pain should not be ignored, as they can indicate significant liver damage or complications that require medical intervention. Ascites, in particular, can lead to serious complications such as infection, kidney dysfunction, or spontaneous bacterial peritonitis if left untreated. Therefore, if you experience persistent abdominal swelling, pain, or discomfort, it's essential to consult a healthcare professional promptly for evaluation and management. Number 1. Unexplained bruising and bleeding. The liver produces proteins necessary for blood clotting, such as clotting factors and fibrinogen. When the liver is damaged or dysfunctional, as in cases of liver disease or cirrhosis, its ability to produce these proteins may be impaired, leading to abnormalities in blood clotting. This can result in a tendency to bruise easily and prolonged bleeding from minor cuts or injuries. Individuals with liver dysfunction may notice an increase in bruising or the appearance of bruises without a known cause. These bruises may be larger or more frequent than usual and may take longer to heal. Additionally, individuals may experience prolonged bleeding from minor injuries, nosebleeds, or gums that bleed easily. In severe cases, excessive bleeding can occur spontaneously or during medical procedures. Unexplained bruising and bleeding should not be dismissed, as they can indicate underlying liver dysfunction or clotting disorders that require medical evaluation. Individuals with liver-related bleeding abnormalities may be at increased risk of serious complications, such as hemorrhage or internal bleeding. Therefore, if you experience unexplained bruising, prolonged bleeding, or other signs of abnormal bleeding, it's crucial to consult a healthcare professional promptly for assessment and management. Early intervention can help prevent further bleeding episodes and improve overall outcomes. Thanks for watching. Don't forget to like and subscribe for more health tips and advice.